there it is. Okay. Good morning, everyone. Thank you so much for being here with us with the informational meeting for the SOQ, Safety Oversight and Quality um, Informational Session Manager position. We are going to go ahead and get started. Like I mentioned before, we have a packed agenda for today, but we're going to start with introductions first. So I'm Teresa Camacho. I'm an executive recruiter. My pronouns are she, her. It's a pleasure to see all of you here. Carissa?
Yes, good morning. My name is Carissa Neufeld. I'm the Deputy Director for Safety and Regulatory Oversight with the Office of Aging and People with Disabilities, and I am the hiring manager for this position.
Thank you, Carissa. Nakisha?
Good morning, everyone. My name is Nakisha Knight Coyle, and I'm the Director of the Office of Aging and People with Disabilities. And so I'll just be here for a little bit. Excited to see so many faces, though.
Thank you, Nakisha. Mandy?
Good morning, everyone. My name is Mandy Autry. I am Carissa's assistant, working alongside her in Aging and People with Disabilities. Great to see everybody.
Perfect. Thank you. And feel free to enter your name and let us know a little bit about you. That way we can be reading in the chat and see who you are and why maybe you're interested in this position. Okay, but let's go ahead and start talk about our agenda for today. So like I mentioned, it's 1 hour for our session today. We do want to try to make it as interactive as we can. So please feel free to raise your hand and or enter your message in the chat, and I will keep an eye on that so that we can try to answer as many questions as we can for the time we have. Some of the topics that we're going to cover today will be Carissa's going to tell us about the vision for this position. Okay. She's also going to talk about the skills and experience that she's looking for and the candidate hired. Does the day-to-day look like for this position? Okay, that's going to be an important one. What makes the role exciting? We're going to touch a little bit on the onboarding and training plan. Also, the work schedule. If it's going to be, we know it's a hybrid. What will that look like? How many days at home versus in the office? And I'm going to talk about recruitment, interview dates. We're going to talk about our screening process that we follow before inviting applicants to an interview. And then we'll leave a few minutes at the end for any questions that might have left unanswered. Okay. So with that said, I'm going to go ahead and pass the microphone to Carissa to get us started with the vision for this position, please.
Yeah, thank you. So the vision for this position, this is a big position, and I'm gonna actually probably mix some of the agenda items a little bit later as I talk about the vision for this position, because I think depending on what you are looking for as a candidate, this is an exciting position. This is an administrator position, which is part of our APD senior or part of our executive team. The position will supervise approximately 150 staff, and I think about 6 or 7 managers. But this is a critical position in helping ensure the safety and health of the consumers that we serve. And the vision for this position is that you will be a leader in helping us ensure the protection and safety of consumers, and that you will lead our 150 staff in being able to do the same. We have some changes that we are making in our Safety Oversight and Quality Unit, some cultural changes, some policy changes, and we're looking for someone who is able to come along with us on that, who will be a champion for those, and who will be able to represent in that capacity as well. Sorry, trying to look at the agenda as well. So I think that, you know, the skills that we're looking for in this position really are somebody who is a seasoned executive with demonstrated leadership skills. So this is not a position, I'm just going to be really honest, this is not a position for an emerging leader. This is not a position for somebody who has been kind of working in mid-management, but is ready to promote up to an executive position. We really need a strong, seasoned executive with strong leadership experience. In terms of skills, this position works with multiple partners internally and externally. So we need someone with strong communication skills, strong interpersonal skills, flexibility, willingness, a strong work ethic, willingness to step up and work the extra, try not to have everybody working beyond 40 hours, but there are times when might need to work a little extra in the day, or we have an emergency situation, wildfires happening across the state, and we might need you to step up and work on a Saturday, you know, to be able to be responsive to our license settings, to be able to help ensure that we're supporting our providers that are out there. I should also just put a little context to realize not all of you may fully know what this Safety Oversight and Quality Unit does. So let me just step back a little bit and make sure that you're familiar a little bit about what this unit does. So within the Office of Aging and People with Disabilities, Safety Oversight and Quality Unit, we are responsible for the licensing and regulatory oversight of all of APD's licensed settings. So that includes nursing facilities. So we have 128 nursing facilities across Oregon. It includes what we refer to as our community-based care license settings, which is residential care facilities, assisted living facilities, including endorsed memory care, and adult foster homes. Combined in all of those settings, we have close to 2,000 licensed facilities or foster homes across the state. So this unit of 150 or so is responsible for being able to provide supervision, management, leadership to the staff who are doing the licensing, doing the regulatory oversight. We also investigate licensing complaints. Latest data is we have about 5,000 licensing complaints a year that we are processing. We're processing the complaints. We're doing the corrective action component as well, including appeals for facilities who may disagree with the corrective action that we're taking. So that's a really high level overview. We also have other components in terms of data, quality assurance, management of our corrective action licensing management system, management of our long-term care website to ensure that the information is transparent to the public. And then a big piece, as you can imagine, in the administrator role is helping to navigate the socio-political environment. Again, we've got external partners. We have the long-term care ombudsman who works to help advocate and provide voice to residents in licensed facilities who may have concerns. We have our provider association, so the Oregon Healthcare Association and Leading Age, as well as a few different adult foster home associations and councils. We have the Governor's Commission on Senior Services, which is an advisory body to the governor's office. We frequently interact with legislators who have constituents who express concerns about their experiences. We have, of course, legislative bills that we are often navigating. So as you can imagine, there's a big balance between, leading the day-to-day work as well as navigating the socio-political environment. People, of course, are very interested in ensuring that our consumers are safe, that residents within our licensed settings are safe, and that they're getting a high quality of care. This is a top priority for aging and people with disabilities. And this position, the expectation is that you will help lead this work, and you will have the skills and ability to be able to navigate all of these hills and waters that we have to move through. So I'm going to pause there, see if folks have any questions based on what I've said so far.
Thank you, Carissa. And again, feel free to raise your hand or just unmute, or type your question in the chat and I will read those for you. And thank you for engaging with the introductions.
So I will talk a little bit about what I think makes this role exciting. If you are a person who likes to build, if you're a person who enjoys innovation, if you're someone who enjoys collaboration, building relationships, helping to improve the system, helping to make public policy, make it, but also help the public understand it, help strengthen our system. These are all things that I think are exciting. If you're a person who really enjoys being able to improve the services for Oregonians and ensure the safety of older Oregonians and adults with disabilities, this is the job for you. So it's an exciting opportunity. This is not just, we need a captain to man the ship. This is, we're looking for a captain to help turn the ship in the direction we want it to go. We've got some building to do. So in some cases, it feels a little bit like we're possibly, building a new ship as well. So again, if you're looking for a challenge, looking for professional development to just be able to refine some of those skills, I hope you will apply.
Hi, Carissa. I have a question.
Yes.
What are some of the long-term goals of SQO division in improving the safety and quality in long-term care facilities?
Well, our long-term goals are certainly, we don't want to see anybody who's residing in a residential care facility harmed. We want everybody to have confidence that when they're moving into a facility, that the facility is operating in compliance with our regulatory rules, and that they've got strong systems in place, that they have qualified staff, that they are engaged, they've got the staffing that they need. It's not our responsibility to ensure that they have staffing, in the sense of we're not doing the hiring for the facilities and things like that. Those, they're their own businesses. But our role is to be able to assure that we have strong administrative rules that support that mission. that we have staff who are skilled and trained to be able to go in and do licensing and regulatory oversight, that when we do have to take corrective action, that it's intentional and that it makes sense, and that it's compelling people swiftly, those facilities swiftly, to come into compliance so that we can assure their safety, the resident safety. We want providers to be successful. I think it's really important. That's where the emphasis on collaboration is important. This is not an us-them kind of relationship. We have a role in regulatory oversight, but we need providers to be successful. So this is a partnership. And that's the mentality I really want our successful candidate to have, is that, there are going to be times where we are going to have to say, sorry, facility, this is what we're doing. We believe in this particular, policy or this regulation, but we need to be able to do it all eyes wide open. We want to ensure that our facilities understand what the rules of engagement are. So when we call them on it, it's not a surprise. And then it's fair. These are businesses. It costs money to be able to do the work that they do. So we want our staff, our 150 staff, to have clear policy and practices, that they're consistent in their practices. And so the long range goal is that we have residents who are safe, and that we have confidence that there's a high quality of care because of the at least of the work that we do. We know that people are, accidents are going to happen. There are going to be perhaps situations where abuse is going to happen. A rule violation is going to happen, but how we all respond to that collectively with providers is what we're really trying to strengthen.
Yeah, it does make sense. Thanks, Carissa. It's a win-win thought to think about the positive outcomes and having an aim to um, make the situation. Yeah.
Thank you for the question. Um, Carissa, so I think we were still talking about what makes the role exciting, and I know you covered a lot there. So let's pause again and see if anyone else has questions on what we have shared so far.
Would you like me to talk a little bit about the day-to-day?
Yes, please.
All right. Well, your day-to-day, this is a 8 to 5 Monday through Friday position. Of course, because it's in executive leadership, it does mean that occasionally you may be called upon to work late, work early, work over the weekend. Generally speaking, you would be involved in lots of meetings, and we would at executive level, with your management, in the safety oversight and quality unit. We are looking for a more hands-on manager, in the sense of being able to get in and go shadow a survey. It doesn't mean you have to be able to do a survey, but go shadow a survey with your survey teams at a facility. Nikisha and I have been visiting facilities all across the state. So we want this position to be able to go out, visit facilities. We have local licensors for the adult foster home across the state, and those are based out of our local APD offices and our local area agency on aging offices, AAAs. So we want you to be able to go out and visit the local licensors as well, and hear from them around what is working, what's not working, those kinds of things, visiting with adult foster homes. because really, in order to be able to lead the work that SOQ does, you need to be able to understand it. And you need to be able to hear from providers, from the staff, how the decisions we're making are impacting our providers and our staff. So it's a continuous process mentality, right? And so we want your day-to-day to take all of those sorts of activities into consideration. It is a hybrid option. I work in the office all the time because that's my personal choice, but it's not necessarily a requirement for you to be in the office. So it is flexible for some conversation, but it is an expectation that you will be out and about in our communities and meeting with people in person. Lots of meetings virtually, of course. There are times where you'll be asked to come into the office for meetings with our executive leadership. We do periodically have retreats as well to get together and talk about, how are we moving all of APD forward. So there are frequent meetings and expectations of in-person interactions. During legislative time, you may very well be asked to go and attend be at the Capitol, listening to a hearing or testifying in a hearing. Most of the time, that pleasure is left to our director and our deputy directors, but there may be occasion where this position would be asked to go and testify as well.
Thank you, Carissa. All of that sounds very interesting. Please, applicants or interested people, feel free to ask questions, okay? This is your time with the hiring manager. And if you are going to be applying, we want to make sure that all of your questions get answered. Okay, so again, feel free to unmute or drop your question in the chat and I can read it for you. All right, so Carissa, I know you shared about the hybrid schedule. We talked about what the day-to-day looks like, what makes this role exciting. Can you talk a little bit about the onboarding and training plan that we have for this applicant?
Yeah. So the onboarding will probably depend on what experience you come in with. So if you're already familiar with aging and people with disabilities, for example, that, some of that initial orientation may not apply as much, but we have been working really hard to shore up our onboarding training, which if you are brand new to aging and people with disabilities, would include an overview of our aging and people with disabilities, sort of just mission, vision, values, all of those kind of basic sorts of things, some background around that. We've been doing learning sessions, which really dive deeper into the history of APD, the different sections of the work that APD does. And so we've been recording those, and those we're trying to make available to new staff coming on board, because it's important, even if your role is focused on safety, oversight, and quality, to have a broader understanding and context of what the Office of Aging and People with Disability does, who we serve, and the services that we have to offer to our consumers. So it would be providing some overview. It would be my expectation that you would be prioritizing going out and shadowing and meeting with the teams within under your umbrella. So shadowing on facility survey, shadowing on foster home licensing. Our nursing facility surveys are very different than our community, excuse me, our community-based care surveys. you would be shadowing me with a lot of different meetings as well. Um, going out, like I said, to the local offices and visiting local offices so you can meet the local licensing staff. If you've never been in a nursing facility or a community-based care facility from a professional side of things, you know, being able to visit as well. Those, and certainly being able to shadow along with Nikisha and myself as we're doing some of those visits. There would be an expectation that you're doing meet and greets with key partners, with key management, internal and external partners. Like I said, the long-term care ombudsman, the governor's commission, our provider association leaderships, et cetera. So that would all be something that we would expect, in particular, those meet and greets happening in probably the first 3 months of you being on board. Since you will become the face of safety, oversight, and quality.
Chris, I had a question.
Mhm.
So you said in the beginning that you're looking for a captain, in essence, to turn the ship around. And so would you say that between you and Nikisha that you already have the vision of where you want it to go? Or is it part of the expectation for this captain to pretty much, I guess, tell you where it needs to go? So I guess that was my question.
Yeah, thank you for the question. So my position is a new position to APD. I've been in this position a little over 1.5 years. Nikisha has been in her director position for about 2.5 years. And safety is the #1 priority for our consumers, regardless of whether you're a consumer living at home or a consumer living in a licensed setting. Safety is the #1 priority. We do have a vision. We are working on we have an action plan, and we have an external assessment that is happening with a third-party contractor who's specifically assessing safety, oversight, and quality, and really looking at helping us determine where our gaps needs. That assessment includes a SWOT analysis as well. And so whoever steps into this position will be able to step in with some recommendations already. And so, you know, an expectation that they're sort of moving forward on those. Obviously, depending on, I mean, our goal is to have this position hired soon. So, and that assessment is scheduled to be fully completed by June. So, ideally, we would have a candidate identified and working on coming on board shortly around that same time. So, yes, we do have some vision. And of course, at least my approach to working with my staff is I definitely want you to have input in terms of how we're executing those recommendations and things like that. So yes, want you to be, that's part of the leadership piece that we're looking for is to be engaged and not just be somebody who's doing what they're told kind of thing. I don't have time to do that. I need partnership.
So what I hear you saying, it's really about taking those SWOT analysis and those gap analysis that has been identified and being able to turn it around and really make actionable effort to be able to make that change and to steer that ship in that direction.
Yes.
Okay. Thank you.
And I don't want to give the impression that safety oversight and the safety oversight and quality unit, there's something significantly wrong with it. It is, there's a lot of work to be done in terms of building consistency of practice, building policy that's transparent, that's understandable, that's intentional. that there's resource needs that this unit has, and really being able to, understand what the gaps are, help advocate for the resource needs, help rebuild some of the reputation, things like that. So we have amazing committed staff. I want to make sure you understand that too, this is a great team. And it's hard work though, right? I mean, it's hard to be in a place where you're not always liked. And there's a lot of criticism. We get criticism from providers. Why are you doing this? We get criticism from the long-term care ombudsman. Why aren't you doing this? We get criticism from families. Like, an event happened. Why aren't you taking that more seriously? So it's a tough place to be in. So you do need to have thick skin too. So
Thank you, Carissa. Akansha, do you have a question?
Yeah, I wanted to know one more thing that, like, Carissa mentioned that the candidate must be able to take the meetings and travel frequently and meet the providers and the legislative meetings. I wanted to know how frequently do we should be available, or we should be um, taking those meetings, or interact with the regulatory agency or the stakeholders, or long-term care facilities, being the SOQ administrator.
yeah, so you'll get to step into some meetings that are already regularly scheduled. So for example, we have some regularly scheduled meetings with our provider associations. We have some regular schedules with our APD executive team. You would be setting up regular meeting schedules with your management team. So, there's, of course, there are times where we have legislators, particularly during legislative session, where, we're pretty much on notice that at any time we could be asked to come, step into a meeting. You're not facilitating those meetings usually. It's usually, we're showing up, and we have government relations folks that help us as well. And you would be, there's a lot of support around us to be able to ensure that that you're successful in fulfilling your responsibilities. So we do have a communications manager, we have government relations liaisons, we have a senior executive team. So you're not having to always, facilitate, you're participating and engaging in those meetings.
Okay. Yeah, thank you. And what would be the KPIs, like key performance indicators, for measuring that the particular role or job goal has been accomplished in a span of time?
Yeah, I think, some of the key performance indicators, I mean, that's actually an area that we're really trying to shore up, is within SOQ, there's multiple work units that have different performance needs and expectations. So, really, I think the SOQ administrator will be a key person in helping to identify what those key performance metrics need to be to roll up as to whether or not, SOQ in general is successful in the work that they're doing. So that includes one hot topic that's been in the media, as well as questions for our legislators, has been our timely response to complaints, licensing complaints. And so what does that body of work look like? What should the productivity of our staff be around that? Do we have sufficient personnel resources to meet whatever that expectation is? We've had for the last 7 years or so, kind of constantly changing legislation that has added more workload and expectations. And so the complaint piece has been something that's been difficult for us to really get our arms wrapped around. And so we're needing to really establish, some key performance indicators or metrics and quality assurance around that work.
Okay. All right.
Thank
And
you.
this will be personal. I really wanted to ask Carissa that you said that you have spent 1.5 years in this position in this organization. So how was your experience considering the work culture?
Yeah, so I've spent my entire career in public service
Uh-huh.
and here in Oregon. So I think I was new to APD,
Mm-hmm.
not new to government service or to necessarily to the state. But it learning APD and the culture of APD, was took me a little bit of time. But I think, that I will say that I wouldn't have come into this position and I probably wouldn't have stayed in this position if it weren't for our executive leadership. We have a very strong, Nikisha is an amazing director. We've got a deputy director for policy, a deputy director for operations, and then myself, the deputy director for safety and regulatory oversight. And the four of us together are really wanting to ensure that our services are providing the needs of our Medicaid consumers across the state and ensuring the health and safety of older Oregonians in general, because we also know our system, particularly SOQ, is supporting private pay individuals as well. Who are residing in these licensed facilities. So I think there's a strong commitment, a unified commitment amongst our senior leadership and our executive leadership around what our mission and goals are to supporting older Oregonians and people with disabilities here. So that is the direction that we have been given. I think it's a supportive culture, but we have expectations, right?
It is, right. And it is at service. The job is always at service. And I'm really passionate about healthcare, like since my when I started my college time, and I've decided that I love this domain. Um, I think I'm gonna learn a lot in this position, and I can deliver a lot. So yeah, thanks a lot for explaining.
Yeah, thank you, Akansha, for the questions. I do see a question in the chat that Mandy is going to take care of. Well, there was someone asking for the strategic plan for ODHS and the organizational chart for ODH, not for ODHS, I'm sorry, for APD. So Mandy was saying that we do have an org chart for APD that we can send to all of you when we send a copy of the PD. Is there a strategic plan, Carissa, for APD, or just the one that we have for ODHS?
Um, Sorry, I am walking to get my charger for my computer, but I will talk at the same time. So we have an action plan that we've drafted up for safety and regulatory oversight, which includes our adult protective services and our safety and emergency response efforts. So it's inclusive of the work that safety oversight and quality does. We are in the process of incorporating our assessment, the recommendations coming from our assessment into that action plan. And so whoever comes on board will have the opportunity to be able to dive into that in partnership with our adult protective service administrator and our safety manager and myself.
Thank you, Carissa.
I have a question, and
Can I hold for? I'm sorry, Maria.
Okay.
Brooke has been holding her hand for a while, and I want to give her a turn, and then we'll come to you, Maria. Okay? And then after Maria's question, we're gonna pause, and I'm gonna start going over part of the screening process that we're gonna do in the interview date, and also the interview dates, and then we can open it up for questions again. Thank you so much for being patient, Brooke.
Thank you. Chris, I was just wondering, I heard you say that you and Nikisha have been going out to facilities and doing some visiting there with them. And I'm really curious to hear on those visits what some of your pain points, what some of the pain points you've heard from the facilities have been and what they're needing out there.
Yeah, I've really enjoyed going out and visiting facilities. I think that we've been looking at, we've been visiting facilities on the full spectrum of performance. So there's, some really some facilities who are doing wonderful work, and then there are facilities that are struggling. And I think, what I'm hearing is are things that are really kind of validating some of the data that we're seeing. So facilities are really struggling with behavior. We've got residents who are who have dementia, particularly folks in our memory care facilities who are not just coming. The residents are more complex. And so they're coming in with comorbidities of medical, behavioral, the cognition challenges, and the tools to be able to support workers and being able to address and meet the needs of those complex residents are just not enough. Falls. We see falls as being the #1 incidence that's happening. And we all know with older individuals that really can be detrimental, not only to the quality of life of a resident, but also to their lifespan. And so, really struggling with how do you support that? Residential care facilities are not designed to have a one-to-one staffing, or even 1-to-5 staffing, right? And so, how do you operate a facility at a reasonable price, and, meet the needs of residents? Workforce, I am hearing that workforce is improving across the state, but it's still a challenge because, they're competing with other industries, that are paying similar and that are a lot easier to do. If you go to Panda Express, you see you can make $22 an hour working at Panda Express, and you do your shift and you go home. You work in a facility, you're attending to people's care, and it's for anywhere from $17 to $22 an hour. So there's a lot of good workers out there. There's a lot of good meaning administrators and wonderful foster homes. And so it's what they want is predictability and consistency in licensors that are coming in. They want people who are supportive, and they understand they need to stand up to the regulations that we have, but can they be transparent? Do they respectful, professional, supportive? That there's an understanding this is a partnership. This is not an us and them relationship between our regulators and our providers. We need them to be successful. And so, they understand the importance of accountability. But they're looking for tools and support from us as well, so they can be successful and fulfill that mission of keeping, we share a mission, right, of residents being safe and having high quality of care. So.
Thank you, Carissa.
Mhm.
Brooke, did that answer your question?
It does. Thank you.
Very good. All right, Maria.
Thanks. Sorry. Oh, sorry for jumping in there before. So I think my question, Carissa, is for me, like it is important for me to do meaningful work, and this sounds very meaningful. I do have some experience working with elderly populations. My father passed away last year from Parkinson's disease. I'm on a nonprofit board for people with Parkinson's in the local area. So I'm familiar with, some of those communities and so forth. And obviously it's important to me because I give my time for free for that. I think my question is two parts. One, how important is it that somebody applying for this position, and maybe you're going to cover that in the screening, Teresa, and if so, then we can skip over that. But how important is it that somebody applying for this position has experience working in like the medical field or the long-term care field or et cetera, is the first one. And the second one is for the organizational culture. I want to know, like, how do people feel about coming to work, right? Like, I want to get up in the morning and look forward to coming to work. And would you say your staff generally feels that way? Or are people like happy to be there and enjoy the work they're doing?
Yeah. So I think as far as your experience with having worked with long-term care facilities or the medical field, it is not necessary. Certainly it's helpful to have some experience, whether you worked in one or had some other professional relationship with that area. Again, I came in from outside of APD. I had some personal experience with working with some facilities in terms of placing my mother into a facility. But I had some other public service experience that made it an easy crosswalk in. So it's not a requirement. It's probably helpful. It will make your learning curve easier. In terms of culture, I will say we're in a moment of change. So it's quite possible that you would talk to a staff and they might say, yes, we're absolutely excited in the direction we're headed. And then others might say, we like what we do, but we're a little in the question of, what direction are we going? Because we're in, anytime you're going through change, it's you have a spectrum of different opinions about that. We are trying to move us towards a direction that is, again, it's a partnership, and it's understanding a clear sense of what our role is as safety, oversight, and quality, and a sense of urgency to be able to address issues so that everybody can be safe and we can have high quality services.
Thank you. I appreciate it, Carissa.
Thank you for the question, Maria. All right, Carissa, I'm going to start talking about screening process and interview timeline. And I know we have about 6 minutes left. And so we might be able to answer a couple more questions, okay? So let's talk a little bit about the screening process that we're going to follow. And if you are already working for the state, you're probably aware of this. But once the position closes, we will start reviewing applications, and we manually read all of the applications, all of the information that you submitted, your resume, your cover letter, the workday application, to determine does this applicant meets the minimum qualifications listed in the job announcement. That is our first screening that we do. So please read the entire job announcement and put in the minimum qualifications in the chat. right now, that's going to be our first screening. Manually reviewing everything and seeing if you demonstrated this experience. Okay, if you did demonstrate that with details, then we're going to move you forward to the second screening. Our second screening is to determine, did this applicant demonstrated that they have most or all of the attributes that we listed in the job announcement. And here I go again, I'm going to put the essential attributes that we had in the job announcement. And so your best bet when you're drafting your application material will be to have the job announcement by you and look at those essential attributes and minimum qualifications and see how you're integrating. If you've done those skills before, right? If you have that experience, how are you integrating that in your resume and your cover letter and in your Workday application? We are requiring a cover letter, so please submit one. That's going to be the two screenings that we're going to do. I will enter all of the attributes because it wasn't letting me do it all at once. 3, 4, 5, 6, 3, 4, 5, 6. We have 4 more attributes. So again, we don't have a system that will screen applications for us. We will read everything. So with the state, we don't believe in one-page resumes. We believe it's important that you talk about the skills in detail. We're not saying write a book for your resume, but do expand on your skills. Okay, so that's going to be the second screening that we're going to do. It's going to be based off the essential attributes listed in the job announcement. As you are applying, I am sending a copy of the position description to you, and I will keep an eye on names today. Send me a direct email or a direct message here, and I can send you a copy of the position description as well if you want to take a look at it before you submit your application. So once we decide the applicants that pass the first screening, the second screening, then we are going to start with an interview called VidRecruiter. VidRecruiter, it's a interview platform. It's a recording interview where we will post 2 or 3 interview questions. We share the link with the applicant. The applicant goes in there and records themselves answering the question. Okay, and we will give you a timeline of April 30th through May 4th. I'm going to share the interview timeline with all of you because we will be holding multiple interviews with our applicants. Okay, so where's that? There's that. We're going to start with the VidRecruiter interview. So you'll have April 30th through May 4th to go and record yourself and answer those questions. Okay. If you do very well, then you will be selected to move to this first round of virtual interviews with a panel. Okay, those are going to be happening May 15th, May 16th. Again, from that round of interviews, we're going to select our top applicants, and then we'll move forward with panel 2 interviews, virtual as well, but this is going to be a little different. It's going to have your panel, and we're also going to be inviting staff to participate. Staff are not going to be interviewing you. They're going to be there to listen to your responses, and they will have an opportunity to provide feedback via a survey. Okay, so at times we could do these panel 2 interviews, town hall, and we could have our panel of like, let's say 6 people, and then we could have like 10 staff that are joining and listening to your responses. Okay, so just heads up that that will be happening. The last round for interviews will be for our top applicants, whoever we decided that did very well throughout all of the interviews, they moved forward, and that's going to be with our deputy director with Carissa. It's going to be with Nakisha, our director, and a couple other folks from our executive team. Okay. And those are going to be in person on June 9th. Okay. In Salem office in our human services building. All right. So we shared interviews, dates. We talked about how to put your application material together. I will be looking at applications that you're submitting. If I do see that there's something missing, I will let you know. But please expand on your skills, okay? Especially if you have a lot of the experience that we're looking for in the job announcement. Carissa, is there anything that you would like to add there?
Nope. I think you
Okay.
covered it.
Very good. Any last minute questions before we end our session today? All right. Well, I do want to thank all of you for your time. If there are any questions that were not answered here, please feel free to email myself or Carissa, and we'll do our best to answer those questions. I will be sending a recording link in a couple of days once I get it all done to all of you that attended and to new applicants that will be applying as well. All right. Thank you all so much for your time, and I hope you have a great Friday and a good rest of your weekend. Carissa, any last thoughts or anything else?
No, thank you for taking the time today to hear about this position, and I look forward to seeing your application in the mix.
Yes. Thank you all.
Thank you. Bye-bye.
Thank you.